Hi guys, this is Dr. Denny with Generations Health and Wellness Center, and in this video I want to actually expand on another video that I had previously where I was talking about genetically you have beautiful genes. You have what's called hunter-gatherer genes. You have Paleolithic genes in your body. We are 99.99% identical to our Paleolithic hunter-gatherer ancestors, which didn't have any cancer. They had less than 1% cancer. They didn't have heart disease, didn't have diabetes, obesity, skin conditions, lupus, MS, autoimmune conditions. They didn't have any of those things. Didn't have the infectious illnesses. And we have the same genes that they have, and we have a ton of illness and disease. And so the difference was the lifestyle. And so I want to address a couple of myths that people have. A lot of people say, well, why would I want to do anything that a hunter-gatherer did? Because we live a lot longer than they do now. And they died at the age of 30. So let's address that one first of all. Think about their lifestyle. The things that they died of starvation. If there's a famine, if there's a drought, they died of starvation. If they also had to hunt their food. We're very fortunate that we can go get in our air-conditioned car, drive and listen to our radio, go into an air-conditioned grocery store and get all of our food in our grocery store. We don't have to go out and use a spear, an arrow, whatever, and hunt for our food. Now they did that, and when they did that, there's times where they had traumas to their body. Something that had been phenomenal for them is to have antibiotics, because if they had traumas and bacteria that got inside their bloodstream that wasn't supposed to be in there, that would cause an infection. They can cause infection, and they could literally die from infections. And so if they had antibiotics, they had a surgeon, that'd be beautiful for them, because that would help take care of them after those injuries, those traumas. But the thing is, they didn't have those things. So yes, sometimes they did die younger, but there's many tribes where they had members of their tribes live in their 70s, 80s, 90s without any illness, any disease. And a lot of times people nowadays, we say that, oh, the reason why we have so much disease is our technology is getting better. Our diagnostic tools are getting so much better. Well, think about this for just a second. Look at obesity. What does it take to diagnose obesity? You could diagnose obesity with you could do it with just looking at somebody, but you could also do it with a measuring tape, and you could do it with a scale. How has that technology changed in the last 20 to 30 years, 50 years? It hasn't changed. And the thing is, obesity rates have gone up like 200% in the last 10 years. So it can't be that we're just having better diagnostic tools. And another thing is, if you look at cancer, we don't have more cancer in our world today because we're living to a longer age. In fact, cancer has skipped generations. The age population that has the most and the fastest growth of cancer is between 20 and 40 years old. That age range, cancer rates are climbing. So it's not because we're living longer. It's because we're more toxic. And so the thing is, if we continue to adapt a lifestyle that's more what our genes and genetics needs and expects as far as health and homeostasis is concerned, we can live a long, productive, long quality of life and quantity of life. And so I hope this helps with those myths. If you guys have any other myths that you want me to address, send those in. Let me know. I'd love to help address those. That way you can become super clear that you have beautiful genes in your body. You have amazing genetics, and you can heal yourself. Your body can heal itself. You can be restored, because we don't have to have illness and disease. It's all a matter of choice and a matter of lifestyle. So I hope this helps, and I look forward to seeing you in the next video.